Sorry, you guys. Again, like I said, you can't apologize for our internet. Hi, thank you, everyone. I'm so sorry about that. Again, it's hard to apologize for the internet and everything like that. I'm fingers crossed this will not be an issue. All right, let me find Dr. Amara again. And okay, she hasn't joined in. Nope, she's not here yet. Okay, so you know what? I really wanted to start with Dr. Amara. We'll give her a few more minutes to come in, and hopefully her internet will pick up. But while we wait for her, I just have a few facts that I want us to read, and this is, of course, as recent as of yesterday. Right now, we currently have 7,261 confirmed cases of COVID. We have 2,007 discharged, and we have 221 deaths right now in Nigeria. The numbers are, they're skyrocketing, but at the same time, I believe that our conversation today will kind of give us a little bit more perspective on how we're faring as a country, because we're going to be talking to some experts on that. So Dr. Amara hasn't joined, so what we're going to do is we're going to go ahead and we're going to start with Temie, because I don't want to keep you guys waiting. Yeah. Okay. So let us get Temie in here. All right. Fingers crossed works. Hi, Temie.
Hi.
How's it going?
Very good. How
So
are you guys?
good. Can you hear me well?
Yeah, I
Yeah.
think I can.
Okay. Wonderful.
Yes.
Um,
Okay.
you can apologize so many times for technical difficulties in Nigeria,
I
but
know.
it is what it is.
It
Honestly.
is, it comes to the territory.
Exactly. It comes with the territory. It's so good to have you in here. Let me go ahead and introduce everyone to who you are. Temie is the CEO of Life Bank, and Life Bank is in the business of saving lives. She's been featured on multiple lists. So I was reading up on her on your Wikipedia today, and I was like, oh wow, this is exciting. This is inspiring. But even more so is the fact that when COVID started, you sprang into action. I was reading somewhere that you said that you were tired of reading about the virus and you kept having nightmares that there are not enough ventilators, and it inspired you to kind of start doing what Life Bank is doing in pertaining to COVID. So tell me a little bit about that and how you guys got involved with the COVID testing centers.
Right. I've been in public health for a very long time.
Yeah.
And so, yeah, like my Twitter account is all public health people from all over the world. I used to
Right.
work at the WHO. I used to work at the UN system, basically all these healthcare folks, and I always follow them. So I felt like I was oversaturated with all the information around COVID. I was meant to be in China in February, I think late February. So I
Interesting.
was like tracking the disease from the beginning, like since late January. Like I was
Okay.
basically like every day I would like log in and check what's happening in China. And it was really for selfish purpose. Like I knew I had to be in China. We had this, we won the Jack Ma Prize,
Yes, yes.
last year. So we were all the top 10 were meant to travel down. And then and I was also meant to travel to speak in Hong Kong. So I had all these travel plans in China. So I was tracking the disease. So I was really like aware of what's happening. And I think what I basically started having nightmares because I was reading about the disease every single day. Like I was obsessed. Like I was focused on it, and I was really worried about what was going to happen in Nigeria. Like I
Okay.
say, Nigeria doesn't have a curve to flatten. We simply have to avoid the curve. Like we don't have. Do you understand? Like
Yeah.
if the curve, if we have over 10,000 cases at the same time, we wouldn't know what to do. Like our health system would collapse.
Right.
So I was really worried, and I had this nightmare about ventilators, and that's what started all the things we've done.
You had like an actual nightmare?
Literally nightmare. Like I dreamt about it. I dreamt that I needed one, and we couldn't
Right.
find one.
Wow.
And the next morning, I woke up, called my team, and I told them like, we gotta find all the ventilators in Nigeria. And
Okay.
so it comes from like a personal thing. Like I literally slept. I'd read too much about ventilators, and particularly it was Italy where they were having
Mm-hmm.
to um, ration ventilators and
Mm-hmm.
choose who gets ventilators or not.
Mm-hmm.
So I was like, I don't want to get to this position. I don't want the country to get to this position. We got to find all the ventilators and have a national register. Yeah.
Right. So tell me a little bit about that national register. I know that you pretty much have you started calling hospital to hospital, asking, what ventilators, how many ventilators do you have? How many ICU units do you have? Um, what was the process like, even especially in getting that kind of information? Because I know a lot of times culturally we tend to be quite guarded with information.
Hmm. I can't tell you because it's our secret. But we basically had to first cajole them, and then we promised them some things that you may be able to rent out the ventilators. If because what we were doing is we wanted to focus on private sector,
Okay.
and private sector, the hospitals in the private sector were not supposed to see COVID-19 patients, right?
Right.
They are all supposed to be treated as the isolation centers.
Right.
And I know that ventilators are in the private sector, right? Like there are tons of hospitals who have those ventilators. So rather than like trying to buy ventilators, we
Right.
figured that we can just have them rented out to the public sector
Mm-hmm.
if demand. So that was what we were doing. So by saying we will be able to give them some revenue, and hospitals, some of them had to shut down, so they didn't really have a lot of income, and they still had to be paying
Mm-hmm.
their employees. So they were really keen to give us that information, but we had to call every private hospital across Nigeria, and it was a lot of work, but we were happy to do it.
No, that's amazing, and it's brilliant. And just to kind of give a little bit of background, Lifebank in no way was generating any income from putting this database together. So I have to say thank you, because if anybody who is watching has at any time they have to be on a ventilator, you should thank Temie, because her and her team found the ventilators that are available in Nigeria. Now, I read an article where it said that there are about 768 ventilators available. Is that number still accurate?
So we were doing ventilators, respirators, and ICU beds. Those are sort
Okay.
of like the critical things. It's not just ventilators. You need
Okay.
ICU beds, and you need respirators sometimes. So we were able to find about over 1,000 of
Okay.
these devices across private hospitals, but we didn't
Right.
count the public sectors. Public sector also has. So we have a good number of them. But I mean, if 10,000 people need to be on ventilators, then we are not going to be. We're not
We're
going to
not.
have it. Yeah.
We're not going to be ready. So
No.
that was kind of the starting point. Now, Lifebank is part of the team that created the mass mobile testing center, which is located in Yaba. How did you land there? What, after you've put this database together, were you still having nightmares? Were you still like, wait, come, I need to get tested? How am I going to get tested? What even inspired that idea of creating a mass mobile testing center?
Right. So I was already hiding in my house. My kids are stopped going to school like mid-February, and I had shut down non-essential life
Yeah.
bank team, and they had all like, everyone went home. And what we did was the people who had to be essential, so the riders, because babies were still getting born, and people still need blood in the hospital,
Blood.
people still need
Mm-hmm.
oxygen, they still
Mm-hmm.
need the medical samples moved up and down. So our core business couldn't shut down. So we still kept that open, but everybody else who's like support staff, like finance, tech, everybody went home.
Mm-hmm.
So I already was hiding out, so I didn't really need to be tested. I had not traveled for a while, and I was just like hiding in my house. And then I had a close family member who needed to get tested. He had come,
Right.
the person had just landed and needed a test. And we have a relationship with NIMA, Nigerian
Yeah.
Institute of Medical Research.
Okay.
It's basically we were running pre-COVID. LifeBank was running a clinical trial with them to use. We have a tool called Smart Bag that uses blockchain to track blood in the country and to make sure that blood is safe. So we were
Okay.
running clinical trial with them. So I had, LifeBank had a sort of like professional relationship with NIMA. So I reached out to them and said, I need to get tested. I need this person to get tested. I need a test. What should I do? And they said they have some tests. So we then, we went to NIMA. The person got tested. It was so seamless. And I was like, oh God, we have to make sure that this is available across the country. And that
Right.
was sort of like when people started, everyone was wondering how they were going to get tested.
Yeah.
People, NCDC, amazing team at NCDC were, basically getting overwhelmed with calls.
Of course.
So I knew that there needs to be, so the way we've thought about this thing is this, like when you're in the beginning of a pandemic, you first need to know what's happening. You need to know what's happening in the community so you can remove people who are positive from the community and at least give yourself a chance to flatten the curve. So for me, mass testing was really critical. We needed to test at least 200 people a day to actually figure out what was happening in Lagos State at the time. And I think
Right.
it's one of the things that needs to happen up north in Nigeria now,
Yeah.
because community transmission is really increasing around that area.
Right.
So we basically just we then had a partnership with NIMA. They said they had a parking lot, empty parking lot,
Okay.
across the facility.
Yeah.
So within 6 days of us having, like, they said yes to the mass testing idea, we had the facility up and running within 6 days, and we got our first patient. So it was really incredible what we were able to pull off and what my team were able to pull off.
Yeah, that's amazing. And what's the difference between the mass testing center and the process of going through, maybe an NCDC testing center? How does it vary?
So, when you go through NCDC or the state government, mostly, they come to your home and they get you swabbed and they go get
Right.
tested. They test your sample. That is not very scalable, right? It is important. It's probably the first thing you need to do, and we did it well, I must say. But it isn't scalable. If you need to test 100,000 Nigerians or even more, if you want to catch up with Ghana or South Africa, you simply can't use just one-on-one testing. You need to have a center that can get over 200, like I mentioned, maybe even 1,000 tests a day,
Right.
for you to actually get to a path where you know what's happening in your population. So that's what's really critical. It's simply the idea. It's perfectly fine. But it's not cost effective and it's not scalable.
Right. So now for this testing center, are all the tests provided? The tests are provided for free, right?
Absolutely, 100% free in our facility, in our testing center. We provide the testing absolutely free of charge to the patients, but it's not free. I mean, someone pays for it.
It's
We have to
funded.
get right. It's
Right.
funded. We have to get donation from a lot of amazing brands who
Yeah.
supported us, but it's free for the patients. Yeah.
Okay. Based on your experience and even being part of establishing this mass testing center, how do you feel like we're doing? Like, I read off the numbers just really quick while you were offline. Let me just go back to it. Right now, well, this is the whole nation. We currently have 7,261 confirmed cases, and 2,000, just roughly over 2,000 people have been discharged, and we have 221 deaths. How do you feel like we're doing in terms of the number of cases and the testing ratio and the population ratio? How do you feel like we're doing?
Um, I have been public all along. I think we need to test more people.
Yeah.
I see a lot of growth in that area. I think at the beginning we had something called case definition. So you couldn't get tested except you were symptomatic or you meet
Yeah.
case definition. So that sort of like delayed our capacity to test. And that was I think we couldn't do mass testing. We had to be selective on who got tested. I understand the reason for that. The kids, there weren't a lot of kids, and we needed to ration to make sure that when if things really get really bad, we had tests that are available. So, but now I think that we're testing more people. I think that our capacity to treat has increased slightly. I think in terms of isolation, I know Lagos State and a couple of other states are already building the capacity to isolate people in their homes, because while testing may not be finite, the isolation beds that we have in Nigeria is definitely finite.
Right.
We don't have, so if you want to isolate people in isolation centers, you may not have enough beds.
Right.
So I know Lagos State and a few other states are looking at how we can isolate people in their homes. That way, we actually have enough isolation centers to isolate the cases we have. I must tell you, I'm absolutely deeply concerned about northern Nigeria. Northern Nigeria has always historically had the lowest number of beds and poor outcomes in terms of healthcare, maternal health, child health, etc. So I'm really concerned about what, and of course the Boko Haram problem that has been there for ages, for decades.
Yeah.
So I'm quite concerned about what's going to happen up north. We're trying to partner with a couple of other tech companies and healthcare partners. We're trying to open a facility in Kano, and we're giving them the support that we have, giving them trainings, and getting them ready to do mass testing up north.
From what you know, I want to talk about 2 points. We're going to talk a little bit about technology and how technology has really helped you guys in terms of fighting against COVID. But from what you know, what is the general response of understanding what COVID is in the North? Are people saying that they understand what's happening, or is it just this, folks disease that people are just shouting about? Does there seem to be a communication that the people in the North are actually able to understand what's happening?
I think they understand. I mean, if you see your neighbor that was perfectly healthy a couple of days ago, all of a sudden dead,
Yeah.
I think that's something that you understand. I think that's something that, you may not have an intellectual understanding of it, but it is an emotional, and it is sort of like a deeply disturbing issue when you see people dying. Maybe it's even your family members. So I think people get it. I think that in the beginning, the virus skipped the north because for the most part, Lagos is the gateway to Nigeria.
Right.
So it was sort of like in the southwest for the first couple of weeks.
Yeah.
And we didn't have anything up north, and people were moving around. People were not really worried, and the reality is they didn't really have much to worry about. But I think a lot of the game with COVID-19 is you don't start protecting your people and you don't start taking action when you already have a problem. You have to do it before so you don't have the problem. So I think that was probably the mistake or the error that was made earlier. And all the states in Nigeria should have been on guard once we had community transmission in Lagos, because Nigeria is one country. There are no borders, right? So, people move up and down every single day. And not, like only a small amount of people, fly in Nigeria. People are going via road up and down. Made as a country. Yeah.
Hello.
Hi, I can hear you. Can you hear me?
Okay, good. Yeah, go ahead. You were talking about the interstate travel.
Yeah, so I was saying, the virus moves with people, and it's only when it is the rest of the country, every state in Nigeria should have been on guard since we had community transmission in Lagos, and we weren't. And I think that's what we're paying for now.
Right. So I want us to go back to technology. You talked about how in the North, you're partnering with technology companies to find ways to do a lot more testing. How has technology been able to really assist in terms of fighting against COVID? And what ways do you think it can actually be utilized to make sure that information and communication is being spread as effective as possible?
Right. Technology, we focus on the testing part and not for the most part communications. So I think that a lot of people are on social media, a lot of people are on Facebook up north, a lot of people are on WhatsApp. And I think while we all blame WhatsApp group often, And we all don't like being added to those groups. I definitely don't like them. I think that getting important information through those groups might be really actually critical. I think
Right.
we complain a lot about fake news on WhatsApp.
Yes.
I think real news can also be used with the same medium in passing real news across WhatsApp groups and making sure that we're reaching the right people. And of course, radio. Oh my God, radio.
Radio
We
is
need to
huge.
get on there and tell people exactly what they need to do to keep themselves safe. But tech has been really useful for us. Co-creation hub, amazing people at co-creation hub built a really critical platform, Nigerian homegrown platform that's been able to help us with the facility we ran in Naima, with the facility we built in Oyo State, and with the new facilities we're building in these new markets. So the technology that they built has been really helpful. It allows us to, select people to get tested, focus on people who are at risk, most at risk. It allows us to track their contacts. It allows us to pass the results to the right party. And it allows the lab to be more organized.
Okay.
So I think for us, technology has been the cornerstone of all the things we did. Quip that we built, technology was part of that. Technology is
And
part
Quip
of,
is the database. It's the database that has all the information on
yes,
the right.
yes, it's the national register for
Okay.
the medical equipment. So
Okay.
technology was the core of that. And then we started doing medical oxygen recently. We started expanding our medical oxygen delivery across the country. We were supported by a company called Dan Odins. And we've launched medical oxygen delivery, free medical oxygen for COVID-19 patients in Lagos, in all the 3 isolation centers in Lagos.
Yes. Yes.
We launched medical oxygen delivery for isolation centers in Oyo State. We're about to launch in Abuja and Kano, and hopefully even Port Harcourt. So for us, it is really clear that that important strategy, test, isolate, treat, we're really helping the country, Nigeria, fulfill the requirements to test widely. We're not doing much in isolation, but we're helping with testing, and we're also helping with treatment. Because while everybody has heard about ventilators, what's actually most critical for treating COVID-19 is medical oxygen. I'm sure you heard about the Prime Minister of the UK who had to be put on, very high-grade medical oxygen, and he didn't need a ventilator. Like about 40% of COVID-19 patients will need oxygen. Only about less than 10 would need a ventilator. So medical oxygen is really, really critical, which is why we're really focusing our attention on making sure that this therapy is available across isolation centers across Nigeria.
From I'm curious to find out, do you have any information on how many people who are sick, who are in isolation centers, are currently needing this? How many, or even the fact that, are Nigerians having cases where their people are critical? Because there's this kind of narrative that can you hear me?
Now I can hear you.
Yeah,
You
hey
went
Timmy,
away
can you
for
hear
a little
me?
bit.
Okay,
Yeah.
cool. Okay, wonderful. So, a lot of people are asymptomatic. Is that, from what you know and insider knowledge, is that true? Is that accurate?
I think generally our cases skew to the young, and I think that's been our saving grace. The virus came to
Right.
Nigeria via the places where a lot of young people live. If they had landed, hello?
Yeah, I'm here. I can hear you.
Right. If the virus had landed in a small village somewhere, it may have been, much skewed, to the elderly. The reality, and I think our saving grace is it's really difficult to transmit the virus outside. And we are really a lot of the places that are in danger, where a lot of congestion happen, like in markets, farms, etc. They're outside, so it's hard to transmit the virus outside Two, a lot of people who are positive skew to the young. We're not seeing a lot of cases in 65 plus. There are some cases,
Right.
but not a lot, which means that we're having milder cases, right?
Right.
My concern, and I think what we're seeing perhaps up north, is that the virus is really attacking people who are much older, and the mortality rates may be more significant.
Right.
As everybody knows, it is a disease that affects people who are older, who have comorbidities, who are comorbidities, who have some sort of pre-existing conditions. And for us, we've been very lucky, right? I would say that our own cases has been, for the most part, with the young people.
Right. So I have a few more questions, but just to everyone that is watching, thank you. For those of you who are just joining us, we're talking to the CEO of Life Bank, Temie Giwa-Tubosun, and she has been in the front lines in regards maybe to building and helping to set up some mass testing centers, and also in terms of putting together a database that lets us know what Nigeria currently has when it comes to the ICUs and respirators and also ventilators. If you guys have any questions, you can post them into this space and then you can put it in the comment question thing. I think we have a question inside as well. I'm on Instagram all the time, but I swear I don't know how to do Instagram lives, just blow me over. I have a few more questions to ask you in regards to, the easing of the lockdown. I mean, all of us kind of have like mixed feelings about it. I mean, I know I still haven't gone out. I'm not playing games. But that's also because I work online, and a lot of the work I can do online. Do you think that we're at risk for it feels like it's kind of just been steady. We haven't seen like a huge surge in numbers, but do you think that's because the testing hasn't come in, the results haven't come in, the infection hasn't shown up in people's bodies? I mean, what do you think about that?
I'm absolutely concerned about lockdown. I am seriously, whether easing lockdown or not. There was a very, hitting the peak is one thing. We know that the virus, the slope can come back and become another peak, and it is quick. I'm especially worried about places where there's a lot of people sitting in the same rooms with the same air, and and they're all strangers. I'm especially concerned, and I think we've done. To be honest, I have to commend the fact that places of worship have not been allowed to open. The factories are what's really, really concerning, because when you have a factory, you have a ton of people in an enclosed place. You probably have central air conditioned. So there's some places that I think that we need to be very careful, testing factory workers, testing people who are maybe banks, making sure that we're ensuring mask wearing in those sort of places. But I must commend that we're the churches are not back, the mosques are not back, because that's really where you're gonna get into a lot of trouble.
Yeah, definitely. And let me just go in here so I can see the question. Okay, so it says, based on your access to first-hand information and the fact that Life Bank cannot handle it alone, what gaps still exist in Nigeria's fight against COVID? So what gaps do you think there currently are?
Right. I think that we really, as a country, I think we really need to focus on being building things, making things. It's still really, really hard. Even testing, one of the things that has delayed our testing is getting access to things we call the RNA extraction kits, getting access to the kits itself. There's a global shortage, so we can't really compete. And if we can't compete, we can't really get people tested, because those are critical materials you need for testing. So for me, I think that Nigeria needs to, if there's a big lesson that we need to learn, and I think if there's anybody who's listening, it is, how do we make sure that the country starts producing things? How do we produce masks and gloves and and how do we produce vaccine? Are we even looking at that? Are we just
Exactly.
expecting
Or are we just waiting?
are we just waiting?
Yeah.
Do we have any special thing to offer the world in terms of this virus?
Right.
What are we producing? And I think for me, that's what I want to see people talking about.
Right.
What can you make? We are working on a platform called Stock Bank that basically uses some sort of data science to predict need for PPE and
Okay.
consumables. And so we've been talking to local manufacturers of PPE, and you'll be surprised how little we have. You know, I'm really excited about what's happening across River and Aba and a lot of these places, and I want to see more of that.
Timmy, can you hear me?
Yeah.
Yes, I know you were talking about Aba, and you were mentioning what's happening, in states where they're taking the initiative to even produce. Second. We have one question here that I want to see if maybe you have some thoughts on. Hold on one second. Let me see if I can find the question. I thought it was very interesting. Oh, they were talking about antibodies. The question is Nigerian health sector considering antibody testing for return to work? Do you have any thoughts on that?
Literally, I actually just had a meeting before this call where I was like trying to break down what it means. I am not a scientist,
Right,
so
right.
it has to be explained to me
Okay.
myself.
No
So I
problem.
literally had, I had one of the senior scientists, senior fellows, Naima. We had a quick chat this afternoon where I was basically getting him to break down what are the sort of not the difference between antibody or anything like that, but just trying to understand the science and
Right.
the equipment that's going to be needed, how you can actually make this work. I think that it's worth it, particularly if you're not using any of those kits, because none of those kits are good yet. We've not really found one that is specific and sensitive enough to actually for us to actually rely on.
Timmy, can you hear me? Hello? Hello?
Yeah, I don't know what's wrong with the internet. It's just
Can you
breaking
hear
up. Can
me?
you hear me?
I know. I'm so sorry. I don't want to hold you on any longer, and I know I know we've had a really good conversation, and thank you so much for shedding some light and giving us some insight. This is like pulling teeth. It's like pulling teeth. Thank you so much, anyways, Tammy. I really appreciate it, and thank you for taking the initiative and just doing amazing, amazing work. Honestly, thank you for saving lives. You guys really are in the business of saving lives. And I pray that God continues to bless you and give you more ways to be innovative and be a hero in so many different ways. So thank you so much.
Thank you so much. That was so kind of you. Thank you for your time. Bye, everybody.
All right, bye. Okay, so internet is literally driving me crazy, but we're in the home stretch. Now we're going to be talking to Dr. Amara, and she was the doctor that found the index case of COVID in Nigeria. So I want to get her on here. Hopefully her internet is going to be doing well as well. Make sure that you send in your questions. All right, there she is, Dr. Amara. Let's see if we can add her in here to get in on this conversation. So Dr. Amara, she has been so inspirational. Hi, Dr. Amara.
Okay.
Hi, can you hear me?
Yes, I can. Hi.
How are
I've been struggling
you?
with I'm fine, thank you.
It's fine. It's fine. Everyone is struggling with their internet. Honestly, it's fine. Everyone is struggling with their internet. It's been rough. even my last conversation with Temie was a bit of a struggle, but we're gonna hopefully this will go seamless. So thank you so much for being here today, Dr. Amara. It's so good to see you. It's good to have you here. Now, for anyone who doesn't know, Dr. Amara is a doctor that identified the first case of COVID in Nigeria. And I want to talk to you a little bit about that experience, because I was watching an interview and, you know, it was kind of like an instincts experience. When the first patient came to you and, you know, he just mentioned that he wasn't feeling well, what was going through your head? Like, at what point did it register that you were like, wait a minute, this might be COVID, someone who is COVID positive? Tell us about how that clicked. Oh no.
That day, that it was just normal, like every other day. And then when he said he had a fever, I just thought, initially I thought he had been in Nigeria for longer than he was. So while I was chatting him up and getting his history, and I realized he had been in Nigeria for just days, that was when everything just went. He has. Hello, can you hear me?
Yes, I can.
Can you hear me? Okay. Okay. So he has a fever. He's been here for just 2 days. And my office was really, really cool because I had the AC on. And from when he came in to when I started thinking in that line, I checked his temperature again and noticed that it had gone up a bit.
Right.
So I figured, wait, this is probably COVID-19 because I've been following the trend, the news trend, and I had just received an updated training as well, if you get what I mean.
Right.
So I just thought, okay, I think it's better to just test him. It's just better to screen him, you know. So and at that point, we had chatted for a while.
Right.
We had chatted for a bit. So I told him what I thought was wrong with him. And then he protested a bit. He said, but I don't have a cough. I don't have difficulty breathing. I don't have chest pain. At that point in time, I thought to myself, okay, I'm going to have to escalate this. How am I going to convince anyone that this is most likely COVID? You know, so at that point, I had a difficult decision to make. It was either, well, not say anything and not be wrong, or err on the side of caution and probably be wrong. So everything happened in a second because I was thinking, if this guy goes and he's positive, it's going to be catastrophic. But then if we test him and it's negative, well, the worst thing that will happen is I'm probably, you know, going to be written up or something, just anything. So I just thought it's best to err on the side of caution. So I counseled him, gave him a face mask. Then I informed I now escalated the case.
Yeah.
And then to my bedside director, Dr. Judoko, and then I called my CMO on site, and I told her, I said, look, this is what is going on. So we have to brief every other person, and we have to, you know, decontaminate the clinic. We all have to wear our PPEs, and so we put him in isolation. And then while we're doing that, I kept thinking to myself, oh my goodness, what's going to happen to me? I'm asthmatic. We don't know anything about this virus. Am I going to die? You know? So and at that point in time, because we weren't sure, we didn't have a positive result yet, I couldn't say anything to anybody. You know, I couldn't even really call my parents and say, oh, see, look what's going on. When you're kind of in
that place of limbo, as a doctor, what do you do? Did you go into quarantine immediately, or are you still kind of just watching and waiting?
Okay, so what happened was I had contact with him. So I was taken off from having contact with patients.
Okay.
Hello? I was taken away from having contact with the patient, just in case. Just in case, yes. And then the good thing was that the result came out almost immediately, and by 27th, the result was out. So it didn't take so long to make the to confirm that he was positive. So there was really not so much time in between when I flagged the case and when the results tested positive. So that didn't really disturb us so much.
And you went into quarantine, and I watched your
my
interview. You mentioned your interview on CNN, and you mentioned how, while you were in quarantine, that you cried a lot. And can you tell us a little bit about the feeling? Like,
Sorry?
I said, you mentioned that while you were in quarantine. Can you hear me? Amara, can you hear me? Hello?
You're breaking.
Yeah,
Hello?
can you hear me? Can I keep going?
Hello?
Yeah, I can hear you. I can hear you. Hello?
Should I reconnect?
Yeah, go ahead and hang and reconnect.
Let me try reconnect.
Okay. So she's gonna go ahead and hang up and reconnect, and we'll see hopefully if network will be good.
This is horrible.
Let me exit you out. It's not easy. This online thing is not a joke, honestly. But I want to see, we do have one question in here. Please go ahead and prepare and feel free to send in your questions so that we can ask Dr. Amara. As mentioned, she was the doctor that discovered the index case of COVID in Nigeria. So we're going to see if we can get her back online. Let's see. Okay, hopefully she'll be able to get back in here. But yeah.
Hi,
okay.
and I'm
back. Welcome back.
And it's still
Okay, so what I was asking was, you mentioned on your interview with CNN, you mentioned that while you were in quarantine that you were crying a lot. Dr. Amara, can you hear me? Oh, I don't think she can hear me. I don't think she can hear me. Yeah, I know. After study electricity, honestly, we need great internet in this country.
This is happening.
I know. We're gonna try one more time. We'll just see one more time. And then try and get her back on here. Okay. Let's see how to make this happen. Okay. Hopefully that will come through. Thank you to everyone for joining us. Thank you so much for taking time on Saturday to spend time with EIE. And thank you also to EIE for asking me to be part of this. I feel very honored. Looks like she's not able to join in on this call. We'll just give it a few more minutes. I'm not a healthcare expert, so I can't really answer any of the questions, but I can say this. As usual, stay safe, you guys. I'm begging you in the name of God, please stay safe. Please. Like, wash your hands, avoid going out, don't do party. I know some people, the thing about it is Nigerians, our natural inclination is to be very sociable and to try and connect with one another, and I understand that, but this is not the time for that. So please avoid any social gathering, avoid any jalaganting all around. Please stay at home because none of us want to be the scapegoats for COVID, honestly. Dr. Amara is not even on the call anymore. She's completely gone. Let me try one more time and see. Oof, it'd be good to have her back, but I know this is a huge challenge. Okay, it's connecting. Okay. Hi. Can you hear me? Dr. Amara, can you hear me?
Yes, I can hear you now.
Hello. You can hear me?
I can hear you loud and clear. Yes. Oh my God. Yes, I can hear you.
Okay, so the question I want to ask you, and I'm just gonna, before our internet does waka waka, I'm gonna ask you this. What do you think is the most important thing for someone to do when they feel or suspect that they have had contact with anyone that's COVID positive? Because you mentioned that while you were in quarantine, you cried a lot. Can you talk to us a little bit about the mental state that you were going through?
Yes. Well, I was quite worried. I was very worried, and I was scared as well because first of all, it was my third time in quarantine, and I just thought maybe I had bad luck. Firstly, I thought I had bad luck, and at the same time, I was thinking, I was wondering what will happen to me because as at that point in time, what we knew was that the virus was more deadly, was deadly to people that had underlying health conditions.
Right.
And then
And
I
you
kept
mentioned
thinking, oh,
you were
I have
asthmatic,
I
right?
have as yeah, I have asthma. So what does that mean for me? Yeah. So so
And then
I
what?
kept thinking,
How were you able to
I have
process
asthma.
it?
So what does this mean for me? And then I think on the eighth day, I woke up with a sore throat. I woke up with a sore throat on the eighth day, and I thought, oh God, I'm dead. I'm finished. So I called my mom and I said, hey, mommy, I have a sore throat. I'm going to die. And after praying, I took my phone. I made a video. I made a video. I made a video of me crying. I was saying, oh, no, it was really emotional. It was really emotional for me
Yeah.
because yes, because the only thing I had was hope, really. That was all I had, hope. So there was nothing anybody could do for me. So that was mostly, that was what mostly tormented me because nobody could do anything for me.
Right.
So yeah, so I think yeah, that was it mostly, and it was just me and my thoughts and my family and
Yeah.
supportive friends.
Now,
Yeah, so
are you back
but
at
what
work
helped me
now?
get oh yes, I am. As a matter of fact, I'm in Ogun State right now. So
Okay.
hence the
Okay.
network is a bit shaky.
No shade to Ogun State. Have you come across any other COVID positive cases?
Well, yes, I
You
have.
have. Now, this time going back
Yes.
around where, you're seeing someone who's possibly COVID positive, what's the difference between the first case and the first experience and all the other cases that you've seen?
Okay, the major difference is that right now I have it at the forefront of my consciousness that everybody is potentially
Got it.
COVID positive.
Got
I
it.
think that's how everybody should approach this because they are asymptomatic people as well.
Yeah.
So
Yeah.
you can't just trust someone's health history off the bat like that. So because of that, I'm careful now. I'm more careful rather. I wear my PPEs, I wear my glove, my masks. I mean my gloves, my mask, mostly my gloves really, hair cover and goggles if I have to examine someone. And before we see a patient, we already have all these precautionary measures set in place. There's a screening table, so you're screened before you come into the clinic, and then when you come into the clinic, you're going to have on a mask, and even in the consultation rooms, we observe social distancing, and the windows are open, the doors are open, the AC is turned off, so there's no recycling of the air, and then yes, exactly, because some studies have shown that when you're in a confined space, the tiny aerosolized viruses will float around for
Right.
quite a while.
Right. Right.
And yeah, so if someone who is positive comes into that place and has on no mask, and you walk in there, even if you up to a few hours later, you could potentially get infected. And
Right.
it's worse when you have an AC on because it recycles the air. So it just keeps recycling it.
Got it.
So because of that, yeah, we put up our ACs and then we maintain the social distancing. And we don't do the face-to-face consultation anymore. So we do side to side. So side by side rather. Exactly. So I'm facing this way, the person is facing the other way, and we're just beside each other and with 2 meters or 1.5 meters
Yeah.
apart. So with all this in place, the unless you don't really observe the precautionary measures, it's really difficult for you to get infected. And so with the other cases, I had these in place, and yes, I had these in place, and now we have more symptoms of the COVID virus compared to February when all we knew was fever, cough, sore throat. Now we know that there's diarrhea. Although my the index case had diarrhea as well.
Okay.
But then it wasn't known that diarrhea was one of the symptoms.
Gotcha.
So now we have diarrhea, we have, so we have fever, diarrhea, sore throat, cough, body pain. Anything, in fact, can be a COVID symptom. You know, the other day I spoke with one of the doctors in an isolation center, and I asked her, I said, do you have any tip for us at the front line, us that we, the doctors that receive the patients? And she said to me, you know what, treat everybody as a potential patient, because anything can be a symptom. Someone, because you have asymptomatic people. So how then do you tell the ones that, you know, a positive person apart from a negative person? So you just have to have a very high index of suspicion, which I think is what I had, a high index of suspicion. And then you have to take a proper detailed history, because the chronology of the events is very, very important. Yes, of the symptoms is very, very important to make your diagnosis. And another thing too is when it comes to you, when you're seeing your patient, because you're the one on ground, you're the one experiencing the patient as well, the best thing is like to stick with your guts, what you think, what your diagnosis is. Stick with your gut. The worst thing that could happen is you're wrong and the person is tested and it averts the crisis. That's the worst thing that can happen.
Definitely.
So, and that's basically what I do.
Wow.
That's basically what I do.
Thank you so much, first of all, for giving us the update on just symptoms that we should be mindful of, and also just for being so sacrificial. You know, Dr. Amara, I couldn't do what you do, period. And it takes a lot of sacrifice. It takes a lot of sacrifice and a lot of commitment. So what I want to find out, do you feel like, in your perspective, do you feel like people are being cautious about COVID? You know, from talking to people who have come in and are COVID positive, when you ask them about their history, where did they go? What did they do? How did they contract? How did they become COVID positive? Was it negligence, or was it just life happened to them?
Well, I think it's mixed. I would say it's mixed, because a lot of people are aware of COVID, and a lot of people are taking precautions, and some of the people that have even taken precautions have got infected as well. And that's because it's not dependent on you alone, which is most important, which is the reason why there's all this noise and all the fuss about COVID-19, because it's not dependent on just you. You are taking all the precautionary measures, and the people around you aren't taking precautionary measures, or they are putting up a facade like they're taking precautionary measures. You could get infected as well. So I wouldn't necessarily say it's because of negligence or because of outright or just ignorance. No, I think it's a collective thing. It's a collective thing, because it's not totally dependent on one person to protect the person's self from getting infected. So so that's it. That's it. Because a lot of people that met, they usually don't even know how they got infected. That's why like Temie said, there's obviously community spread going on. So you could just go to the market and come back and boom, you have COVID. If they ask you to retrace your steps, you would really be at loss, because you've been doing everything right. Yes, so it's basically, we all just basically need to pull our efforts together, because we have a common goal, which is to defeat COVID.
And I like that you said that, and I think that's a perfect note to kind of end on. It's collective effort. You know, if you're the only person doing what it is that you're doing, someone else who is not doing what they're supposed to be doing has the potential to infect you, which is why we kind of have to keep each other accountable. So, you know, situations where a friend says, oh, I'm going to X, Y, and Z. Why are you calling each other out? You know, calling people out on the fact that you need to be responsible. Do not go here if you don't have to go there. If you're now, especially on weekends, the only movement that should be happening on the weekends is supermarkets. Outside of that, I mean, if you're not going to work, then why is there movement on the weekends? And I don't want a situation where any of us fall sick and it's a scapegoat kind of thing, where the worst thing is to have to learn from something that's tragic, you know? So yeah.
Yes.
Dr. Amara, do you have any last words for us before we wrap up?
Okay, well, I would like to say that, like I've always said, it's a really tough time for everybody,
Yeah.
regardless of whomever. It's really tough across the nation.
Yeah.
And I would acknowledge also that it's tougher on some other people than it is for others. And that's why I keep advocating that we be each other's keeper,
Mm-hmm.
you know, in any way you can
Mm-hmm.
contribute to making some other person's life easier. That could just be the one thing that will stop or save the person from getting infected, and in turn really save you and other people around you.
Yeah.
So we should keep hope alive, take all the necessary steps, hand washing, respiratory etiquette, social distancing, use our face masks, do not touch the front, wash it after at the end of the day, and do not put your face mask under your chin. I see a lot of people do that. It's wrong. Yes, the way, and then they leave it under the chin. You're going to track the whole thing back to your nose when you eventually do put it on. So when you take it off from
Take
the
it off.
straps,
Yeah.
wash or discard, and then wash your hands. So, and support each other in every way. Everybody's difficulties right now is very valid because we're all experiencing different things and going through different things. So basically, let's support each other and keep fighting.
Yeah. Well, thank you so much, Dr. Amara, for taking time
Thank you,
off your
Bolanle.
schedule. It was so lovely
Thank you
to
for
meet you
having
in
me.
person. Thank you for
Thank
doing what it
you.
is you did and for, in so many ways, helping Nigeria fight against this virus. Stay safe, please. Stay safe. We'll be praying for your safety and your
I will,
family.
you too, and thank you so much.
Thank you. All right. Bye.
All right, bye.
All right. Well, that is it. We pushed through. Nigerian internet does not allow us to fail in this life. Anyways, thank you so much to everyone for having us, and thank you to EIE again for this series. Please stay safe, you guys. Wash your hands. Wash your hands. I pray that we all come out of this well, alive, and our families are safe, and we have safety with our loved ones as well. And stay at home if you can, and if you can't, wear a mask, wear gloves. All right, seriously. All right, thanks, guys. Bye.